The Bob Murphy Show, episode 441.
There's a tidal wave coming. What you gonna do?
Get ready for another episode of The Bob Murphy Show, the podcast promoting free markets, free minds, and grateful souls. It's your source for commentary and interviews conducted by a Christian and economist. Now here's your host, Bob Murphy.
Hey everybody, welcome back to The Bob Murphy Show. Today my guest is Ray March, who is Research Assistant Professor at the Free Market Institute, which is at Texas Tech University. He's also Assistant Director for Free Market Institute Programming and the Christopher Culp Professor of Economics at the Norris Vincent College of Business at Angelo State University. He's published numerous articles in the Journal of Economic Behavior and Organization, Health Economics, and the Southern Economic Journal, as well as several others. So I met Ray. He was a PhD student when I was at the Free Market Institute. And so you'll be able to tell when we start the conversation, that's how we know each other. And I saw he recently had an op-ed in the Washington Post talking about the use of AI by RFK's team. And, Ray had some critical commentary, but then also gave some insights into how AI is being used effectively in the healthcare space. And so since we talk about all that stuff here on the Bob Murphy Show, I thought this would be great fodder for a conversation. So here we go, my discussion with economist Ray March. Ray, welcome to the Bob Murphy Show.
Well, thanks for having me, Bob. It's nice to see you again.
Yeah, nice seeing you again. As I would have explained to the folks, we knew each other via Texas Tech. And so I was pleasantly surprised. I'm on the Independent Institute's email, digest or whatever, when they summarize what their fellows and associates have done. And you had recently an op-ed in the Washington Post, I believe, talking about healthcare and AI and the Trump administration, all things that we cover here on the Bob Murphy Show. So I said, let's just get Ray here and can you go through your argument? And I'll either stop to clarify or even push back if I think the audience might be wondering.
Yeah, absolutely. It's an op-ed I just published recently in the Washington Post. And I think that people who believe that the HHS under RFK Jr., right, the Department of Health and Human Services and the Food and Drug Administration, they're trying to use AI effectively to streamline their processes. And I think that the belief that they're going to be able to do that is hallucinating, if you're familiar with the term. Mm-hmm. So there's been several episodes of this, actually. The most recent one is that the Food and Drug Administration has launched a new AI assistant. Its name is Elsa. And the goal with Elsa is we're going to look at some of the earlier phasing mechanisms of the FDA. So some of the initial phases, is the drug safe? Is it effective? And when you have to get these drugs approved, you submit hundreds and hundreds of pages right through new drug approval processes. And that can take months, if not years, to really get through the bureaucracy. So one of the main goals of Elsa is we're going to use AI to summarize these documents, to hit the highlights, to help categorize these new drug applications. And that gets launched in June. And then weeks later, FDA employees are saying Elsa is not working, right? Elsa is miscategorizing drugs. Elsa is misreading some of these statistics. And they actually accuse Elsa of hallucinating, or some of them have accused Elsa of completely hallucinating. They're making up stuff that's not in these applications.
Yeah, maybe, Ray, just if you pause for a second, just for folks who don't know, when we hallucinate, it's not that it's just some term that Ray likes to use or something. It's in the context of these large language model AI engines, chatbots, or whatever you want to call them. What will happen is sometime you might say, hey, can you give me a list of the 10 most successful musicians from the 1950s by record sales? And it'll give you a list, and some of them are just completely made up things. But if you didn't know and just looking at it, it looks like a good answer. Or other times, I've heard people doing research, and this is partly how people, college kids will get caught using GPT or whatever to write their term papers, is sometimes the teachers will just recognize, the bibliography or works cited, they just invented things, and the kid who doesn't know, and you think why would it? And so there's this idea that, what the AI is doing is like what I would do, but just faster. And it's like, no, that's not really how those things work. And so anyway, so people call that hallucination because it's not like it's lying. It's not malevolent. It's just that whatever the the mechanism is by which it determines this is the answer I'm going to give to the question the human typed in, then, or the response, I should say, to the input that the human gave, or the prompt, I guess is the more neutral term, that it's just, it's possible something comes out that from our point of view is like, they just made that up. That's called hallucinating.
Yeah, it's literally a bug in the system where it'll think it has information correct and it'll get it incorrect. It's funny you bring up the students cheating on the paper thing, right? The HHS actually got caught cheating on their paper. Yeah. One of the other examples I give in the op-ed. But anyway, so ELSA, about a 2-week process going through. It's miscategorizing information. It's miscategorizing drugs. So that makes it harder for the FDA to figure out, okay, which kind of approval process do we need to go through? And as you pointed out, right, it's giving information to FDA officials that's not true, right? It's simply not in the document.
Okay, so just to stop, the point of ELSA, what the promise was, is that, part of the reason it takes so long for, some pharmaceutical company has a new drug application and the FDA has this approval process, the reason it can take years is that some human has to sit there and go through the hundreds of things for every application on the old way. And so if we had AI that could go in and sort of summarize things and move the ball down the field so that, the humans coming on the scene now, are starting at the 40-yard line as opposed to, the beginning. That's the idea.
It's the same idea as if I asked it to summarize The Wealth of Nations, right? I could read the 800-page book, or I could say, what are the main ideas? They're asking, or FDA officials are asking ELSA to do that for new drug applications.
Gotcha. Okay.
So,
okay. So then several weeks after launch, some people, insiders were saying this just doesn't work.
Yep, it's not working. It's giving us bad information, right? Which, as slow as the FDA is, right, getting bad information is not going to make that process any better. And RFK and the FDA argue back saying, no, these are disgruntled employees, right? It's not as bad as you might think. And to be fair to the FDA, which I often don't do, right? When you have new technology and new pieces of software or AI, right, broadly, right, there are bugs. Right? We do find errors in it, so that's believable. But I take the op-ed in another direction and saying, yeah, we can grant them a little leniency here, but this isn't the first time the HHS or the FDA, frankly, have had issues with this. So going back, really about April of this year, right, there was a massive document that was released by RFK and the Department of Human Services. It was sort of his big launch into what he wants to do with MAHA, right? Make America healthy again, right? So he's got a document and he's making arguments about some of the bigger things he's covered, right? We got to look into the root causes of autism. We've got to look at pesticides. We got to ban a whole bunch of food dyes. And some of these are more controversial than others, right? But this is a massive document. Here's what I hope MAHA is going to do. And we come to the end of the document and we have the undergrad college students problem, right? Okay, where is he getting these sources, right? Where is he finding all of this information to argue this is what the HHS and the FDA need to be focusing on? And kind of like these infamous papers that we've all heard about, right? There's dead links, so we can't find the information he's citing. And there's several studies that were, again, hallucinated, right? We can't find any reference to these studies, let alone what they find that he's using to bolster his argument. And to be clear, that document had about, as far as I can remember, about 120 citations. So it's a massive document. Well, what I've been able to dig up is there was probably close to 20 or 25 either dead links or just hallucinated studies.
Okay.
That's the problem.
Okay, so there, the issue is prima facie. It just looks like the people that were involved in creating that document probably relied on some LLM to do some of the heavy lifting and didn't catch that, oh, wait a minute, this thing when we said, we're summarize the literature here and blah, 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 and that they didn't go and check and realize, no, this thing just made up some of these citations.
So there is independent studies saying, how in the world did you have that many dead links and how did you have citations of things that didn't exist? Independent study says that's probably most likely ChatGPT.
Right. And
there's a broader problem here. It's one thing to have bugs in software you're using to summarize, fairly complicated clinical trial documents. But they're not even using, if this is true, right, ChatGPT correctly to make papers, right? Or larger documents.
Right. So I want to disentangle those two things because you're right. Both of them are concerning, but the second thing you just said, I think, is way more alarming. So just so people at home didn't get lost there, there's two separate things Ray's talking about. On the one hand, there was this sort of for internal FDA employee use ELSA system that was supposed to enhance productivity. And then some people are grumbling and saying, no, this is actually making our job harder, or it might lead us to approve something or go down the thing with, something that based on erroneous information. So, but that's not like the public is directly interacting with that. Whereas here, the second thing you're talking about is HHS actually released some big document on the topic of making America healthy again with recommendations, or this is what's going to guide us going forward. And here's the scientific research, the clinical studies or whatever, backing up what we're saying. And you're saying in that document that was released to the public as, a publication of the HHS, if you go to the citations, the references or whatever, there are some things in there that are clearly just made up fake studies. And so that means the HHS officials, that went out the door, that nobody caught that. And so that's concerning that whether it was a human on their staff who made those things up or, was it mistaken, or someone that relied on GPT or whatever to do it and didn't catch it. Either way, they screwed that up. And so that's clearly, a boneheaded mistake at the very least.
Yeah, and that is a document that is supposed to make America healthy again forward, right? These are the 6 or 7 things that RFK is very, very concerned about and wants to make large-scale public health initiatives to do. And the document can't even provide evidence as to why.
Right.
So that one to me is particularly troublesome, right?
Yep. And so, yeah, I mean, I'm just trying to think that through. I mean, the best case scenario I could come up with is if the people who really are acquainted with the literature and they have good reasons, if you grab them and interrogated them as to why we think these are the bullet points in terms of the policy changes we want for HHS going forward that really will make America healthy again, that they kind of just delegated and said, here's the main points, go write this up. And then the lower level staffer cheated a bit or relied on GPT and didn't catch, and that nobody caught that. But yet, if you pushed them, they could say, okay, yeah, it is true. Those 2 studies, I don't know how that got in there. That's made up. But really, you could use these 4 studies here, blah, 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 from JAMA and blah, blah, blah. And that would back up what we're saying. Like, that's the best case scenario you can come up with.
Even this might be too little optimistic, right? This is 24, 25 studies out of about 120, right? So this is...
The distinction I'm making, though, Ray, is I'm saying, as opposed to, like, they really weren't sure what the direction would be, and they kind of let the LLM tell them, you should go do this, this, and this. And they're like, oh, yeah, that sounds good. And then say, here's the studies backing up. Oh, okay, it's empirical, it's data-driven. Let's go do that. Like, that would be the worst case scenario, is that the policy were being driven by, as opposed to they kind of knew what they wanted to do, and they could have justified it and got sloppy. So, yeah. Okay.
Yeah, absolutely.
Okay. So then someone said, oh, so your op-ed, the whole point was just, hey, they're trying to use AI and it's, not ready for prime time yet. And AI is not appropriate for healthcare policy. That's not what your op-ed is saying.
That's not what the op-ed is, right? Saying that RFK is confused and makes mistakes, that's not an op-ed, right? That's him being human, right? That's government documents having errors with them. And that's important, right? But that's not the entire story. It's way too strong of a statement to say that AI should not be used, right? Let alone used in healthcare. AI has incredible applications in healthcare. As complicated as healthcare is, right? Language learning models and other AI tools can make incredible leaps forward in healthcare. The distinction I try to make in the op-ed is you have government agencies trying to use it. They tend to use it inappropriately. We can go through that if you'd like. But you don't see those big of mistakes or even those common of mistakes as being made in the market. And in many cases, what HHS under RFK is trying to do has already been used in the market, right? Or if you will, AI has been used effectively through the marketplace to tackle some of these broader issues. And I think that gets lost in a lot of cases. Most of our focus on RFK and the HHS is to criticize him, criticize his views. And to be fair, I'm criticizing some of his stuff too, right? But there is an alternative. And I think a lot of that gets lost in mainstream news, in op-eds, right? In public discourse. Is that AI is wonderful, right? But it has to be channeled through the appropriate mechanism. And unsurprisingly, right, I think that mechanism is the market.
Yeah, and you have some good examples that I want you to elaborate in a second here. But let me just elaborate on what you just said. And so folks, I didn't check I don't know what Ray's views are like on the broader RFK worldview about, vaccines or in particular, like in the COVID era stuff. But I would say this, especially if you're somebody in the listening audience here who really likes what RFK is doing and was very happy that Trump, put him in such a high position given his controversial reputation. And you really do think that, oh my gosh, yeah, it's crazy what, the vaccine schedules they have for kids now. And I really do think, and, Jenny McCarthy was right and blah, 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 or she shouldn't have been demonized at the very least. If that's your view, then you really want to make sure that RFK's team isn't doing sloppy stuff, right? Like they got to just do everything above board and just be bulletproof in terms of, no, here are the studies that this isn't crank science. We have these, peer-reviewed journal articles. You certainly don't want to release a big document on Make America Healthy Again, and there's made-up citations in it. That's because that just confirms to the critics that, yeah, this guy's just bluffing or this guy's nuts. Like this is amateur hour. What the heck is going on? Which you have seen, especially Democratic critics saying as stuff comes out. So anyway, I just want to clarify, Ray, that it's your point in this op-ed was not like, oh my gosh, this guy doesn't believe in science. Like that's not what your point was. It was, this is sloppy.
No, I don't have particularly strong views on RFK Jr., the person. Mm-hmm. I think he has iconoclastic views. I'm more than fine with it. I have many iconoclastic views myself. But the reason that RFK draws such a large attention and has a lot of supporters, right, and some of them probably listen to the Bob Murphy show, is that he wants to stand up to special interests, right? He's not convinced that the way that governmental science has been going is appropriate. He thinks it has led to a lot of bad alleys, right? Vaccines, food dyes, right? All the things we're familiar with RFK about. But my point isn't that we can take a pro or a con stance, or we can agree mostly or not mostly with RFK. My point is, whoever you have in charge of the HHS or whoever is working with the Food and Drug Administration, they're not able to use AI effectively. AI has to pass a market test, right? It is ultimately a means. Finding the appropriate way to use this means requires feedback. Government agencies, including the HHS, regardless of who's in charge of it, right, in many cases lack this feedback, which I think is probably the biggest reason why you can see AI flounder really, really spectacularly, right, in the case of Maha. But you can see it help people lose weight, help it use potentially dangerous pharmaceuticals more effectively, and you see that taking place in the market, right? A lot of cases, it's the same AI, right, but it goes through a very different mechanism, or if you will, a different test.
Yeah, so here, let me just read an excerpt from your op-ed and have you elaborate. Though injectable weight loss treatments such as Wegovy and Mounjaro, I might be mispronouncing, have helped millions lose weight, they, like other pharmaceuticals, can be harmful if misused. Whereas Kennedy aims to reduce patient use of these drugs, private companies are channeling AI technology to help patients use them more effectively by tailoring doses, adjusting their diets, and alerting them when the treatments are not working as expected. So can you just elaborate a bit on that?
Sure. Most of your viewers are probably going to be familiar with Wegovy, right? It's a very, very popular weight loss injectable drug. It was called by the New York Times, right, a miracle drug, and that was in a headline 3 months after they published an article saying, "What's Wegovy?" Mm-hmm. So it became incredibly popular. It's very useful in terms of helping people lose weight. It helps type 2 diabetics who have hormonal issues, right, lose weight. So it's a great drug, but understandably, drugs that have that much benefit or that much potential benefit also have costs, right? People have died from using Wegovy. People have gotten very sick from using Wegovy. People have had kidney and stomach issues from using Wegovy. So we enter probably the biggest question we have when we talk about medical economics or medical science, right? How do you balance the benefits when you also have to deal with the cost, right? Or if you will, side effects. Mm-hmm. And there's two alternatives, kind of like what I had just mentioned here, right? There's the RFK governmental perspective. Okay, benefits and costs, we can use AI to try to assess them. But ultimately, what government and what the HHS and the FDA have the authority to do is say no. So RFK, for better or worse, at least in some of his public testimonies, has said Wegovy and Mounjaro and these other weight loss drugs, they're too dangerous, right? We got to get rid of them. We have to look to alternative mechanisms to help people lose weight. That's one perspective, right? What I'm trying to argue in the op-ed is there a way we can try to recapture the benefits, right, of losing weight, but also try to mitigate the costs? Well, the way to do that is to help people who are on Mounjaro or Wegovy look to how is the drug actually working. And there is an entirely appropriate role for AI. And we've seen telemedical companies like Ro have been able to install this. There are AI softwares which say, okay, enter your information, enter your weight and things like that. And they can catch preemptively, right? Okay, you're probably not using enough. You're probably using too much. Let's tailor the dose. If I start to see other effects of that data, we can say, okay, what about these symptoms? And if you report some of the symptoms, right, stomach cramps being one of the early signs you're using too much of it, they can say, okay, we got to tailor the dose. We might want to try something else. Maybe we need to also implement some other dietal restrictions and things like that. So AI is able to figure that stuff out. Mm-hmm. And that has helped even more people use a very powerful, right, very useful, but I mean, sometimes dangerous drug. And just to be clear, millions of people have used these drugs. Right? This is a very common drug, but that also means potentially hundreds of thousands or thousands of people, right, might get some of the harmful side effects. And AI is helping them avoid that, which is radically different than saying no, right, which is what the government ultimately decides. So,
folks, let's take a break from the action for this important announcement. If you care about your liberty and your financial freedom, you need to hear this. From October 10th through 12th, Mikkel Thorup, host of the Expat Money Show, who's been a guest on this program, is bringing together top experts from around the world for the Expat Money Online Summit, and it's completely free to attend. You'll learn how to legally protect your wealth, secure second residencies and citizenships, reduce your tax burden, and own property abroad, all to safeguard your freedom. This year's focus is Latin America, where opportunity is booming. Argentina is shifting to free markets, and as an aside, word on the street is that Milei recently told his top lieutenants that they should go read my booklet, Chaos Theory. True story. That really happened. El Salvador is undergoing a dramatic transformation, and Panama and Paraguay are offering simple residency programs. A Plan B is no longer optional. It's essential. So reserve your free ticket at expatmoneysummit.com. That's EXPAT moneysummit.com. expatmoneysummit.com for your free ticket. Do it today. Let's get back to the show now. And then here's another excerpt. Other AI-based apps provide exactly what Kennedy wants, a reliable way to lose weight without drug-related side effects. For example, the weight loss app Mindset, and mine is with a Y, utilizes AI to, quote, retrain the brain, end quote, in ways that help patients lose weight naturally, and this is said to be 5 to 7 times more effective than standard diet and exercise routines. All right, and so anyway, besides that particular one, like I see like YouTube ads and things for these stuff that, you know, it's, you get your own little personal coach or something, and you know, you could just see that there's ubiquitous ways that those things for people who wanted could incorporate that. Just, you know, it's like, oh yeah, if you started weighing yourself every morning and keeping track of that, that might be helpful if you're trying to lose weight, and you can kind of just see what's working and what's not, and then, all right, well, if that makes sense, well then something that measures your heart, you know, keeps track of how many steps you took, and and every time you ate something, you typed in, or, you know, had some other way of it knowing what you were eating. You can totally see how, that's obviously just taking all that stuff just one level deeper.
It is one level deeper in the sense, like what you just described there. I get up, I check my weight, I get my steps, I don't eat too many snacks, right? My words, not yours, right? But something like that, that's just standard diet and exercise. And yes, that does help you lose weight. When for RFK's example, right, when you want to restrict access to Mounjaro and drugs like that, you're telling people effectively you have to do more standard diet and exercise. But when you add AI software into, right, AI helps you in the case of the mindset, like I quoted in the op-ed, right? What it's doing is AI as applied to cognitive behavioral therapy, right? So I change rewards and I change costs, which make people more likely to induce certain behaviors, which help you lose weight. It just happens that mindset doesn't involve like a personal trainer or an agent. Like there was a weight loss app named Noom that used to have one of these where you would physically talk to somebody and they would give you encouragement, right? So if you will, changing the rewards and things like that. This is just AI as applied to that. So it's helping you.
Like if you go to reach for a Twinkie, it gives you a little shock, or like
AI is not that advanced yet, right? That might actually work, right? But no, AI cannot give you
like
a shock.
It releases something that smells like a skunk every time you want to get something with a lot of carbs. Like, oh, after a while, I don't want that. That's disgusting.
That would work, right? I don't think mindset works that way, right?
Right.
The cognitive behavioral therapy, right, without, you know, putting smells in your room, right, or hurting you when you try to eat more caloric foods.
I'm just brainstorming here, Ray. All right, if you don't have the courage to go down with me on this path, okay. So yeah. So that's what I'm getting, and I suppose, you know. So you're where I was going earlier when I was saying that you're not just saying because there are a lot of people who just don't like AI. They think it's just a bunch of hype or whatever, and they'll every time some new version comes out, they'll give it some simple riddle that a 7th grader could solve, and the AI fails it. And then say, see, they're going to take over the world. But yet I've seen amazing stuff that these, you know, like even GPT 3.5 could do, let alone later versions and things. So, and I use Claude. It's the one that we happen to use at my day job company, Infinio. and it does Monte Carlo simulations, and I have discussions about Gödel's incompleteness theorems. I mean, in certain capacities, it is incredible, but yeah, other things, it quote has no common sense or hallucinates, like you say. So anyway, I was just stressing for the people that your point wasn't just like, oh, haha, they tried to use AI and that's stupid. That you're saying, no, in your op-ed, you pivoted then, and after you were explaining how AI has not been used very successfully in HHS, but it is being used in certain healthcare applications in the private sector. And
in my op-ed, I paraphrased findings from a peer-reviewed article published in Healthcare, right? And they did a massive literature review, right? A real one, not the one the HHS posted, but they reviewed 500 papers, and overwhelmingly, right, when companies, and this can be medical goods providers, this can be health insurance providers, right? They review 500 of these papers, and overwhelmingly, right, AI helps them reduce costs. You could argue that's the biggest problem in healthcare, right? Is the out of control prices, but it helps them do this in terms of treatment and diagnosis, right? So the two main things that consumers need to get access to good healthcare.
Right.
So it's universal. It's very specifically applied in the case of mindset, or in the case of helping people use Manjaro more effectively. And so why does it work there? But then we see the HHS flounder. I'm not even picking on RFK in this case. Or why does that big government agency flounder and mess up its literature review and use tools ineffectively where it's misreading documents? It's just a difference, if you will, of markets testing versus government application, right? One of them has those feedback mechanisms where it says, yes, this is a good use or a bad use. Or even like you mentioned in your job, right? I'm sure the government could ask it to run Monte Carlo simulations, right? Would you trust those? Maybe a little bit less than in your case, where you have a much stronger incentive to make sure it's running these things correctly.
Yeah. That was that last point, because it sounds like what you're saying. I don't, just me hearing you discuss the various cases. I don't think the conclusion is, oh yeah, so AI is good at telling people here's how to tweak your diet or whatever, or maybe you're using too much of that drug. But AI isn't good at literature reviews. Like, I don't think that's the conclusion. I think the conclusion is that the company that releases that thing for their clients to be giving them feedback on drug dosage, they probably have really put that thing through the ringer to make sure if we release this and our customers are using this, we don't want any crazy anecdotes about it telling people, maybe you should try drinking bleach tomorrow. Like, we don't want that happening. That we're dead if that happens. And whereas with government, the feedback mechanism, the error correction procedures they have in place that, well, we wouldn't want to release a product like such and such because then we might go out of business. No, that's not going to happen. And so, for all those reasons. And then even, it's not even that, RFK doesn't care about whether they put out a shoddy product or not. It's just that you get brought in and you're put in charge of this bureaucracy with a bunch of people that's just how they've been doing things for 20 years. It's hard to steer that ship, like you're going towards the iceberg, it's hard to turn. And so I can see, that there's all those problems built in, and not just that the procedures, but then the people who rise through the ranks, in that environment, it attracts a different kind of person. They get a different sort of mentality and whatever. So anyway, for all those reasons, I can just see that I think you hit the nail on the head. It's not so much that, they happen to pick the wrong way to try to use AI. I think it just has more to do with, just like, it's not like, if we just got the federal government to use computers, then it wouldn't be inefficient anymore. Like, no, that's not, you're kind of missing the point if that's the way you're talking.
Yeah, what's that old thought that if we had the right computers, we could do socialism, right?
Right.
Kind of the same argument is applied here. Right? AI is just a tool. When government uses resources to any endeavor, we always think it's probably going to do it poorly or inefficiently, right? Lacking prices and the feedback and all the things you had just mentioned there. Mm-hmm. The market has that. And I think that's the biggest explanation as to why there's such a dichotomy, why it can help people use potentially dangerous drugs effectively here, whereas it can't get the studies right over there.
Right.
It's not a different AI necessarily, right? It's just a different organization, different incentives.
Mm-hmm. So maybe if we could just pull back, your doctoral dissertation was on like the economics of healthcare broadly construed, right?
My dissertation was self-regulation in the pharmaceutical market.
Okay. So maybe can you just summarize some of your key points in that? Just I partly just because I think it's intrinsically interesting, but also the audience will see why I knew you were somebody that was qualified to come in and talk on this stuff.
I'll try. That was a long time ago. So I'm getting old. I got into healthcare or healthcare economics, health economics primarily because I wasn't convinced that healthcare was so fundamentally different that markets couldn't address some of the problems. I believe that medicine was complicated. I believe that healthcare itself was an interesting case. I didn't believe that therefore you needed to have the Food and Drug Administration, you needed to have the regulatory structure, you had to have Medicaid, or your audience is going to be familiar with all these governmental agencies that try to fix or make healthcare a little bit more better. But what became obvious to me when I started studying pharmaceutical regulation is while you had the FDA, which in many cases stifles innovation, which stifles the delivery of new drugs, pharmaceuticals have advanced tremendously, right, since the 1960s when you had the modern FDA come about. And a lot of those drugs really did work, and they made tremendous improvements in people's lives. But pharmaceuticals still had the same problem that we talked about, like with Mounjaro, right? They have tremendous benefits. They also have potential for side effects and harm. So how were those being regulated? Right? When the FDA was too sluggish to come up with new and innovative ways to regulate new and innovative products, there had to have been some mechanism where there was regulation there. And it came fundamentally down to the market. And my dissertation was more or less 4 or 5 case studies and some econometric models saying, okay, well, how does that actually work? Right? Where the FDA leaves off, where does the market take over, and what do we see as outcomes of that? And unsurprisingly to many of your viewers and you, right, the market does handle these complicated cases well, and that was enough for a dissertation.
Yeah. So it's and I've stressed that a lot too for people. And it's funny how, well, I guess people are more on board with that now than they might have been 20 years ago. But a point that I make often with libertarian people is they're quick to make the case that, the FDA is too risk averse because of their incentives. And if they approve something that ends up killing a bunch of people, they look bad. But if they hold a drug off the market and a bunch of people die from, quote, natural causes or like whatever the disease is, right, it's not blamed on the FDA officials who were too hesitant to approve. And that is certainly true. But then there's also the flip side error, like with Vioxx, where the FDA will approve something. Lots of evidence will start mounting and lots of private sector watchdog groups will say, we don't think this thing is safe. We're advising our subscribers, don't take this, blah, blah, blah. And the FDA should yank it. And then once they've approved something, they're very reluctant to admit, oh yeah, we shouldn't have, approved it. And it sort of gives the public a vote of confidence. Like, well, I mean, if I can go get it, if my doctor's allowed to prescribe it, I can go get it at CVS from the pharmacy. It must be okay because the people in charge wouldn't allow a danger. You know what I mean? So it's kind of the flip side. Whereas if you didn't have the FDA and it really were, it's kind of like buyer beware, but then people, what would they do? They wouldn't just start randomly injecting stuff into their veins. They would, want to know what assurances do I have? And CVS wouldn't just carry anything. Like they would want to know that, we don't want people just dropping dead from something they bought from us 15 minutes later. So just studying those market mechanisms, and it's not, quote, as crazy as some people might think. Like, for sure. In general, I like competition and free markets, but I mean, not when it comes to something like pharmaceutical drugs. I mean, there you really need top down, the bureaucrats do a good job on that, even though they couldn't do, we wouldn't want them running restaurants. And it's just kind of funny. Like, no, if you didn't trust them to run restaurants for all those same reasons, they're not going to do a good job regulating drugs either.
2 points I like to make specifically with regard to the FDA. So regarding your second point, it's not just the case that they're conservative and they withhold drugs that could potentially help people, right? Mm-hmm. What I also like to point out is when you look at the FDA approval process, specifically for drugs, it usually takes about a decade to get it approved. There's something called the post-surveillance period where the FDA can still yank the drug for concerns. That period is typically 14 years. Mm-hmm. So the post-surveillance period is longer than the approval process. So we should be a little bit hesitant when we realize, they still have to watch it for 14 years after they spend 12 years putting it through the ringer. Right. That to me at least causes suspicion, right? Maybe some of your audience will be sympathetic to that. The other one is the real interesting from my perspective, but the majority of cases are not good drug, bad drug. It's not that black and white. If it was that black and white, you probably wouldn't need the FDA, right? Because it would be immediately obvious, right, what drugs work and what drugs didn't. Most drugs are compare benefits and costs, right? Really, really powerful drugs that can help you, can sometimes make you sick, sometimes give you side effects. And those vary by individual, as we know from genomic medication and just know from talking to people about taking similar kinds of drugs. The complicated cases are never really addressed in regulation, right? The FDA's main ability to do things is to say no. right? Or not yet, in the case where it withholds it, right? Complicated cases require lots of trial and error. It requires lots of feedback. It requires specialization of medical knowledge. It requires trial and error from the behalf of the consumer, right, or the patient. That's what a market is, right? Fundamentally, in all products, that's what a market is, right? It's a little bit more dire to get it correctly when we're talking about people's health and longevity and well-being, right? But that's fundamentally what the market mechanism is. So to not trust it in pharmaceuticals and medical devices and other things like that, right, I think is just a mischaracterization.
Yep. You may remember, Ray, and folks at home, I co-authored a book called The Primal Prescription with Doug McGuff, who's an ER doctor, and we did it through Mark Sisson's publication, house company. And one of the things that, we're going back and forth with the manuscript, and one of the things, Ray, that Doug, relayed from his medical training was, and that has stuck with me, I hope I didn't violate my own rule earlier, is that it's a misnomer. There's no such thing as a safe drug. Or if there were, then it would be completely ineffective. Like, so he was, saying that if the drug, and I'm saying it partly, Ray, because you said similar things earlier in this episode, that if the drug has the power to help certain people with certain issues, then it also has the power to hurt other people, in different circumstances. Like, in other words, like the only way that it's not ever going to do something you wouldn't want it to be able to do is if it's not going to be able to do something you'd want it to be able to do, right? So there's that element. And so it's not so much that, we want the FDA to say whether the drug is safe or not. It's that, for these particular people or whatever, that the trade-off, it makes sense, to take it for this purpose, but look for these possible, side effects. And if you start seeing this, then consult your doctor right away. If you start seeing this happen, so there's that sort of thing. And that there's various, statistical measures and concepts about like number needed to treat and things like that. And anyway, so it's really, as an economist, and I'm sure that's partly, what you were just getting at, Ray, it's a matter of trade-offs. It's sort of like a Thomas Sowell thing that, there are no cures, only trade-offs, perhaps, in the medical realm. And that's exactly the kind of thing that markets, perhaps working with like insurance companies that have the right incentives and things in a genuinely free market, would be ideally designed to help people make those decisions. Where you really would not expect the right answers to pop out would be a bureaucratic, coercive organization where they don't suffer the costs on either end.
Yeah, exactly. Even with an incredible tool like AI.
Yeah. So I guess maybe as we wrap up here, Ray, what are your thoughts, just kind of putting you on the spot, but in terms of just your overall assessment? Like, I think a lot of people are not happy with the U.S. healthcare system. What are your thoughts? Like, do you think it's just going to keep going along like this, or do you see like, there's all these innovations that we think are going to bring costs down, or what do you think? Just open-ended, the floor is yours.
All right, that's one way to end it. The amount of lobbying and rent seeking has only increased since RFK has taken place. When that happens, that replaces market competition with political competition, right? So if that's an indicator, I think we're heading for more of the same. But at the same time, the more technological innovation comes about from AI, from learning about where do regulatory aspects lead us, gives at least some plausible pushback against the U.S. healthcare system, which has dozens of very concerning problems, right, that you've discussed on the show before, and that anyone who's been to a doctor has realized right within the first hour or so of being there. Broadly speaking, I'm pessimistic in the short run. I'm very optimistic in the long run. A lot of questioning about the effectiveness of government healthcare came from the COVID-19 pandemic. I think that's part of the reason why RFK has become rose to the ranks that he has. I don't think RFK is the way he's lined up Maha as of now is aligning us for a free market revolution in healthcare, aligning us for more markets. I think it's pivoting towards different healthcare policies, which could be comparatively good or bad. But in the long run, I think after this, AI is only going to continue to make things more effectively. In some of the cases we talked about, in this show and in the op-ed, we see clear cases where AI can help us get better results, right, from market incentives and from market competition. So as long as there is that emphasis, or as long as there is that ability to recognize the trade-off, in the long run, I think ultimately we're poised for a market revolution. As of right now, we got to see what's going to happen in the next couple of years, but I'm not that optimistic.
Okay, fair enough. I think that's what a lot of people are thinking now, the Trump administration, like in various realms, that there was a lot of promise. Now it's like, I don't know, but there's still things on the table that could bear fruit down the road. Okay, well, thanks, folks. My guest has been Ray March. Ray, thanks so much for your time and insights, and it was nice to see you again.
Yeah, my pleasure, Bob. Keep fighting the good fight.
Thanks. And thank you, everybody, for tuning in. We'll see you next time.
You've just experienced another episode of The Bob Murphy Show, the podcast promoting free markets, free minds, and grateful souls. For more information and to subscribe to this podcast, visit bobmurphyshow.com.